Most people think erectile dysfunction is only about sexual health, but sometimes ED can be a clue that something bigger is happening. Welcome back to Workday Lessons. As we wrap up our week on erectile dysfunction and testosterone, let's talk about an important red flag: chest pain with activity. Remember earlier this week when we discussed blood flow? The same blood vessels that supply the heart are part of the same vascular system that affects erectile function. That's why erectile dysfunction can sometimes show up before heart disease becomes obvious. Now, let's be clear. Having ED does not automatically mean you have heart disease, but it does mean you should pay attention to cardiovascular risk factors, especially if someone also has diabetes, high blood pressure, high cholesterol, obesity, a smoking history, or a family history of heart disease. Now, here's where the red flag comes in. If someone develops chest pain, chest pressure, unusual shortness of breath, dizziness, unexplained fatigue with exertion, especially during physical activity or sexual activity, that deserves medical attention. Because those symptoms can sometimes indicate reduced blood flow to the heart. Now, let's make this practical. Many people assume they are simply out of shape, and sometimes that's true, but chest discomfort with activity should never be automatically dismissed. Your body may be trying to tell you something important. Now, here's another misconception. Some people become embarrassed talking about eating and avoid seeking medical care altogether. But sometimes that conversation opens the door to identifying and treating cardiovascular risk factors before a serious event occurs. Now, here's the key point: sexual health and heart health are often connected, and sometimes erectile dysfunction becomes an opportunity to identify bigger health issues early. Now, quick reality check. If you ever experience chest pain, chest pressure, significant shortness of breath, or symptoms that concern you during activity, seek appropriate medical evaluation. Don't try to diagnose this yourself. If you found this helpful, save it, share it, subscribe, and follow for more Workday lessons. Simple health, clear answers, because sometimes the earliest warning signs are the ones we least expect. I'll see you tomorrow. Don't just live, thrive.